Hello and welcome to Global Health TV. Today, we'll be focusing on mental well-being. I'll be looking at how our brains could age better and how climate change affects mental health. Climate change is a global health crisis, and that includes mental health. Whether it's trauma from experiencing extreme weather events or anxiety and other emerging psychological reactions to global warming. At the American Psychiatric Association meeting in San Francisco, California, I met up with Dr. Elizabeth Haase and Dr. Gary Belkin to discuss their work with COP Squared, a global network of organizations aiming to generate tangible policies and actions that can strengthen our ability to innovate and adapt to the climate crisis. Thank you very much for joining us. Really appreciate it.
Thank you.
Thank you. Beth, can we start? How do you think the climate crisis is affecting people's mental health?
I think, in two ways. One is this idea of sort of multiple building traumas on top of community vulnerability, right? And so people are increasingly sort of building up this repertoire of traumas that they've been through and then trying to continue to function. Right, so there was a research project recently that the kids in the Northern California fires, by the age of 10, they have 7 traumas that they're trying to deal with. So we have to deal with that, traumatic stress, but we also have to deal with the kind of dread and paralysis and people feeling like it's so disempowered in being able to make the problem move forward, and particularly young people.
Gary, how have you seen different communities affected by this around the world?
Yeah, and I think the emphasis is thinking at the community level,
right.
Because the sum cumulative total of what's happening to individuals is that it's also impairs the ability of communities to work collectively and effectively in the face of these challenges, which, if we've learned anything from COVID, is if we don't have that kind of social fabric and trust and collective power to fall back on, then we're in big trouble. And in some ways, sadly, COVID was a walk in the park compared to the sorts of challenges that climate change is going to put on communities to problem solve and to support each other. And so we have to, as a mental health profession, really think about and dust off our community mental health toolbox about how we help communities in that way.
So many questions come to my mind when I hear those answers from you. And one, I have to say, when you look around communities at the moment, do you feel that communities are more resilient than they used to be, are more cohesive than they used to be?
I do. Do you?
I think it varies.
Yeah. Yeah.
And that's issue. It's never a steady state. It's always a dynamic, evolving process that ebbs and flows. And so, how do we build the infrastructure to continuously bolster, support, nurture the psychological resilience of communities? Because that should have always been our project. In the face, we know, of poverty and other adversities and other injustices, communities falter and just add to the mutually reinforcing cycles of those things. But really investing in strategies that take psychological resilience as essential a building block as other aspects of community building, we may get ahead of that game.
Which communities have you witnessed that have kind of been affected most by climate change?
I mean, I think, what we all know is that there is tremendous environmental injustice in this, both in the States and globally. So in the global South, you have people that are really suffering undue effects. But even here, I mean, in the South Bronx, where I lived for a period of time, they have, an urban heat island, they have tremendously poor air pollution, they have a food desert, all sort of around this one community, right? That's where we see it. But they also have tremendous resilience within themselves. So they've done a great job.
What is it about climate change in particular that makes it so difficult to deal with in terms of mental health?
I mean, I think it's the relentlessness of it. It's the encompassing degree that it makes everything harder. The kind of future foreclosing sense of it. There may not be something around the corner.
Right.
When I think it was a summer or two ago when Portland reached 115 degrees, it's literally the suffocating nature of it.
Right.
And that is very paralyzing and interferes with our abilities to generate hope and to connect and do work together. And so we really have to put down some roots of social fabric building before those kinds of realities become much more common and normal, because then we'll be behind the game if we don't build those infrastructures for psychological resilience now.
It's something that has a lot of uncertainty built into it, and people talk about it as a hyperobject or a wicked problem. These are terms that mean it's sort of constantly shifting. I think for me, it's about the fact that it's the last on the list. It's like I deal with this. Oh, I probably should do something about climate change, right? But it's actually the first in terms of priority. It's the first in terms of its health threat, right? So how do we get people to really start to connect those dots, right?
It can be difficult though, can't it? Because in some respects, people see it as a big issue, which of course it is, but at the same time feel somewhat powerless at a personal level of what they're supposed to do about it. And can't that add to the trauma?
Yeah. What we talk about is using sort of dialectical thinking to flip that. So like if you're feeling individual and powerless, flip that to being collective and empowered and see what would come to you. But it really is about working with other people in community. And it's also about, not burning out and taking time to restore and replenish, the metaphor of the fields, and allowing yourself to lay fallow, and then something new and creative comes to you. And so you just follow the wave. Yeah.
It was an interesting point that you both made about the sort of need to build resilience within communities. And what sort of tools do we have at our disposal to do that?
You want to try some?
So we have a lot, and I relearned my community psychiatry work in the Global South with efforts that really leaned on communities as the bearers of skills and tools, as the co-creators of solutions, and really leveraged the rich social capabilities and networks and ways of coping that every community has, with the mental health system adding a layer of support and skill building and backup to them. And that's a kind of ecology for psychological resilience that we need to make a new normal. Right. And we have some experience in doing that. When I was New York City mental health commissioner, we developed efforts that did just that. All over the city, we equipped daycare center staff and job training program counselors and homeless shelter staff and school teachers and police officers in all sorts of skills, whether it was acute helping with symptoms, acute symptoms, or implementing prevention, promotion, resilience building sort of skills across the lifespan. So there is no shortage of evidence-based proven ways to do that.
Right.
What we don't have is the will to do it that way, the business models to do it that way, and the culture of practice within the mental health system and people who make decisions about that to think that way. We're really stuck on a very episodic, disease-centered way of thinking about things, not about a community psychological strengthening thinking of things, which if we thought that way would also help at the other end, at the illness end.
Right.
We've been really kind of waiting for people to be sick and come to us rather than being proactive. And it was probably always the case that it was long overdue to stop thinking that way. Climate change makes it a game changer. If we don't think that way, we're going to be stuck, and we're not going to be able to work through this issue.
Talk to me about COP squared. What's COP squared?
Yeah.
So COP squared stands for care of people times planet. So the P squared is the exponential added ability of caring for people lends to caring for the planet.
Right.
And so this large sense of mental health, what it should do, psychological resilience building as a purpose of this profession and of our mental health systems. That premise I found was increasingly being held by all sorts of organizations and actions, not just organizations that have been working on community mental health for a while, but
Right.
globally organizations that are working on environmental justice and gender equity in the face of sustainability and
Geophysics
youth activism. Right, and climate folks
Right.
who were thinking, oh, we are trying to do climate adaptation, but we're working with traumatized communities. That's getting in our way. How do we do that?
Right.
So this enlarged notion of what mental health can do to catalyze action and support communities was coming from all sorts of directions. And those directions are reflected in the membership of COP Squared, which is now 350 organizations and growing that run the gamut of that spectrum. And it's going to take that village of perspectives and skills and credibilities to craft this new approach of global psychological resilience that I hope the mental health profession sees it's needed to be part of and steps up. It's sort of the last one to that party, and it's time they joined in.
Yeah. I mean, I think if you look at what's happening right now in terms of global efforts to build resilience in communities, you have the Department of Agriculture, the Department of Transportation, the Department of Education, and they are charged with creating the resilience within their own system, and they have mental health resilience on their agenda. But they actually don't include mental health in their plans. They only include physical health and how are we going to protect people physically. So I think, the American Psychological Association was out on front with this many years before we were, but it's really time for the APA to get to the table. And this is an amazing opportunity to do it. And I would also say that there are 2 bills before Congress right now. One of them is the Community Mental Health and Resilience Act, which could put $5 million in the CDC to get started with this idea of community resilience. So if you're like a little small town, organization, you can get a small grant and start seeing what works. And then there's also the Green New Deal for Health, which if that goes through is $650 million for every state to get a few $1 million to put in exactly this kind of thing, like exactly this kind of community resilience support and training. Yeah.
And what we hope, Beth alluded to at this meeting, we're inviting folks to come to a town hall to discuss, okay, how does organized psychiatry and individual psychiatrists and our chapters and districts really jump in to this work? How do we use our machinery to move this agenda and also put it to ground, not just advocate? This effort COP Squared, which is sort of the focus of the conversation, is specifically work that we're doing with the United Nations Race to Resilience, which is to put this idea on steroids. The goal of the UN Race to Resilience is to support communities to do climate adaptation, by which they mean, or climate resilience, by which they mean the kind of infrastructure, system strengthening work that the departments of agriculture, education, et cetera, are doing. We went to them and said, you need resilient people for resilient places. And if anything, the Race to Resilience and its goal to reach 4 billion people by 2030 should include the goal of capacity building for psychological resilience. And so they said, yes, we're writing a plan for how they do that. Mm-hmm. And a part of that is to regionalize hubs of implementation. And so the North American hub should have as one of its anchors the American Psychiatric Association. And so that's the challenge we're posing to the group at the town hall. How do we do that? Where do we go? Who's signing up?
What reaction have you had?
Which piece?
Well, what reaction have you had to COP Squared in the wider psychiatric community?
Gary's the leader, so yeah.
Interesting. So when we talk to people working with smallholder farmers globally, when we talk to people who are trying to get mayors across the globe to do climate adaptation, when we talk to all sorts of climate adaptation energized organizations with global reach working with communities, they get us at hello. 5 minutes, they're sold. Okay, how do we think about a way that we also are channels for psychological resilience building, because it's essential for what we're trying to do otherwise? It's actually the mental health folks that pause. Right. And it's puzzling because we as a community have for too long allowed ourselves to rest on a clinical and business model that waits for people to be beaten up by the world and then come to our offices. Right. It's long overdue that we break out of that. And here is a necessity and an opportunity to do that. And I was New York City mental health commissioner for a while and put these kinds of ideas to ground, where we brought mental health partners, behavior providers, as partners to community members to skill them up to actually be the front lines for mental health that they are. And mental health providers, when given that opportunity, were ecstatic. This was some of the most gratifying work they had done. The only thing in the way is the will to do it and the business model to support it.
Well, and I think also the fear of losing control, right? I mean, the thing you do clinically every day is going to be sort of given away, and what's going to happen. There's
but
like
what
a little
they
bit.
found by doing it
It's incredibly empowering, right?
It's incredibly empowering.
Yeah.
Their expertise and reach is exponentially spread.
But it's a big shift in role. I mean, you have to really think of yourself differently as a psychiatrist.
It seems to me a really fascinating issue just listening to you speak, because one of the things that I was drawn to was the fact that you were saying there are a lot of different groups here who are coming together. I won't say at a ground roots level, but very much these overlapping needs become self-evident through the work that different groups have been doing. And then you say at the end there as well about it's a different business model and it seems to me part of the issue, as Beth was saying, is control, isn't it? Not just with psychiatrists, but overall, we're used to having sort of government organizations that control things, and this is something which can't be done that way.
It puts faith in the wisdom and ability of other community members to do this work. But when you dive into that, you realize that it's in the community that most of the wisdom comes from. What are the causes of trauma? What are the things that work? Where are the gaps? Where are the opportunities to further deepen and spread these civic-owned skills?
And what do they find healing for them, right?
Exactly. And it only extends the reach and power of the knowledge that we as mental health professionals have. And there will be no shortage of work to back them up and to fill in the gaps of formal care where there will always be a need.
Well, thank you both so much indeed for joining us. Really appreciate you taking the time out today, so thank you.
Great conversation.
Thank you.
Thank you, appreciate it. Yeah.
Climate change is an issue we return to again and again in Global Health TV. Episode 13 explores water and health. Episode 14 looks at wildfires and extreme heat events. And episode 15 explores the relationship between environmental contaminants and health. You can find all episodes on our website, globalhealthtv.com, as well as our new podcast, The Global Health Clinic. So do take a look. Now, we all hope to keep our brains active as we grow older, from mindfulness to better sleep. We consulted with doctors at the American Psychiatric Association meeting for the best ways to ensure healthy brain aging.
Healthy brain aging implies as you get older that you are maintaining mental acuity and well-being into old age. The World Health Organization says that there's over 55 million people who have Alzheimer's or some sort of a major neurocognitive disorder, dementia. So anything that we can do to promote healthy brain and aging is really, really important. To achieve healthy aging, there are a lot of different components, but some of the main components are proper exercise, proper nutrition and diet, proper sleep, and mindfulness.
We can show why exercise is beneficial. You see changes, structural changes in the brain. You see changes in molecules such as BDNF and inflammatory markers that help prevent this cognitive decline that we see with aging. Whereas with cognitive exercises, you don't see the same kind of mechanistic data available. However, cognitive activities such as learning a new language or staying connected with your friends and family or learning a new task such as a musical instrument, they all have shown to help prevent cognitive decline. So there's no perfect prescription, but any activity is good. It could be hiking, running, swimming, but you have to do it regularly. So there is a dose-dependent effect. So do it regularly, do whatever you can, and stay connected. That's the best advice that we can give right now.
Sleep affects mental health at every age. We need sleep to function on a daily basis in our lives, emotionally and cognitively. If you're not sleeping well at night, I think the first thing I recommend to all my patients is to sort of assess your environment and figure out, is your environment conducive to sleep? Is the temperature right? Is the lighting dim enough? Are you being distracted by electronics? Also looking at some of your medications. Could any of your medications be keeping you up at night? But there are definitely many things that we can do to improve our sleep that don't require prescriptions.
Diet over the years makes a difference in brain health, cognitive health, and also emotional health as well. In general, we know that there are certain diets that are bad for the heart because the heart is an in organ. It receives nutrients and oxygen. So any diets that lack problems and cause problems for the heart will also be problems for the brain as well. Our Western diets, with its heavy emphasis on pizzas or burgers and fries, high salty foods or high fat foods or sugared drinks, these things actually cause problems in the long term for supporting the organ like the heart or the brain itself. However, there are some things that are good for the brain. In fact, it's been found that the Mediterranean diet or the DASH diet are heart-healthy diets. And similarly, those diets are also good for the brain as well.
Mindfulness can be helpful to people of all ages. But in older adults, it's especially helpful with reducing stress, anxiety, depression, and helping to manage pain. You can do things like, meditative breathing, mindfulness-based nutrition, body scan. Those are different kinds of techniques that mindfulness practitioners will engage patients or clients in. And when you're choosing somebody to help you clinically, it would be important to have a practitioner who also practices mindfulness. It can be very, very useful and helpful.
So that's all for this episode. Next time we'll be looking at low-cost interventions for diabetes at the American Diabetes Association scientific meeting in San Diego, California. But until then, it's goodbye.